In this presentation, we will tackle some of the issues related to the transparent development and use of AI systems, both programs and devices designed for health. And we will make a focus on some provisions of the GDPR which support transparency in research and healthcare using personal data. So first of all, it is important to remind that the rationale of AI transparency requirements stems in the fact that more and more human activities tend to be assisted and replaced by AI-based devices and programs. And all the sectors are concerned, including critical and sensitive areas such as health, both in care and in scientific research. Artificial intelligence and machine learning is very promising, but technologically complex, very disruptive, and has proven to be potentially dangerous, discriminatory, and very intrusive with regard to the concerned persons. And now it is obvious that there is a general lack of transparency in the domain and a need to work specifically on this topic. According to the recent EU strategy for AI, the respect of European values shall be enshrined into AI systems. This includes the respect of fundamental rights, including privacy protection, personal data protection, and non-discrimination, but also public health protection, environmental protection, consumer protection, respect the rules of fair competition, and includes aspects related to the professional ethics. In this perspective, transparency requirement is essential to demonstrate that AI innovations, in particular in critical areas, are appropriately considered and integrated in the design of AI products and services. The main objectives of AI transparency are to foster fairness and public control or debates over AI-based program devices, development and use, to allow responsible and appropriate use of AI systems, to empower users and persons affected by AI use, which will not be users per se, to make free decisions and eventually contest the outcomes of the processing, to avoid or mitigate risk of illegal, unethical, hidden practices or development trajectories, and to build and maintain trust of end users and society in AI systems. So as it has been said, AI transparency is part of the 7 essential principles of trustworthy artificial intelligence, whatever the AI type and related products, services, and categories. AI transparency is intertwined with other fundamental principles, in particular the principle of accountability, and it includes traceability, explainability, and communication aspects related to AI functioning, machine learning, functionalities, and attached governance mechanisms. AI transparency necessitates technological and organizational measures to be developed by design and by default, and regularly reassessed throughout the AI system life cycle. It includes specific challenges and probably trade-offs to be further explored by considering, for example, the transparency paradox, on which we could come back in the discussion. But in any way, this principle of transparency is reinforced by medical ethics and various relevant frameworks, legal frameworks applicable to AI stakeholders. So of course, transparency includes privacy and data governance aspects, and we will focus on this. In health, AI systems are developed in order to base or make decisions that will impact directly or indirectly the health of individuals, patients or not, but also populations, if we consider the use of AI-based systems for public health policies, for example. AI systems are developed and can be used by health professionals for medical purposes in the so-called algorithmic medicine, for improving the detection, diagnosis, and treatment of diseases, for organizing the precision treatment, or in medical robotics, for example. But they can also be used by health establishments as logistical tools, but also by insurers. AI, a wide range of various devices of different quality, from medical devices, potentially implantable, to health tools used for well-being purposes. But in any case, the lacks in transparency can lead to unreproducible or biased research results, hiding potential misconception in the AI technologies, what question research integrity principle, and to premature deployment of risky AI-based tools. It can lead to the misuse of AI, infringing human rights and freedoms, and potentially involving life-threatening practices or events. It can lead to material, immaterial damages to the individuals, and engagement of the responsibility of the health professional, health establishment, product manufacturer, and probably other persons. By the end, it will diminish the quality of care and patient-doctor or participant-researcher relationships. So there is a constant need to demonstrate AI-based medical tools added values for evidence-based healthcare and research practices. Ensuring transparency throughout the development will empower health professionals, users to meet their ethical duties and respect individual rights before and after the medical acts. In healthcare and research, personal data processing are crucial for the proper functioning of AI systems and for their development. They are key to develop reliable and accurate programs or devices. Personal data are used as input. They are processed through the AI system that will correlate them with training datasets, eventually through profiling activities intended to evaluate certain personal aspects related to the individual, in particular to analyze or predict aspects concerning the health status of that individual, his behavior, his movements, etc., in order to deliver an output which most of the time qualify as inferred personal data of various nature with an informational or decisional value depending on the context of use. All these activities raise privacy and data protection concerns, which are more or less addressed, I have to admit, through the GDPR. Indeed, AI developments and uses relying on the processing of personal data from Europe must comply with the principle of the GDPR. Machine learning processes are implicitly covered by the legal definition of processing. Transparency of data processing is a key principle of GDPR, wanting that personal data should be processed lawfully, fairly, and in a transparent manner in relation to the data subject. Therefore, data controllers must take care of transparency as an element of privacy by design and by default requirement, and must demonstrate compliance. By doing so, they shall adopt a risk-based approach, and this is particularly helped by the obligation to perform a data protection impact assessment for high-risk processing, and a lot of processing in our domain will qualify for such an exercise. Finally, it is helpful also to say that the GDPR does not fully harmonize the rules in health and research, and that EU member state law could fix actually more specific rules. In the GDPR, transparency obligations is concerning several actors in the processing of personal data by AI. It concerns data controller and data processors with between themselves. They have to be transparent, and they have to be also transparent in relation to the data subject and eventually to third. In our presentation, we will focus on the relationship between the professionals and the data subject, patient or research participant. So let's take back the three main elements of AI transparency identified by the guidelines on trustworthy AI adopted at European level, and to see what kind of elements in the law are related, are supporting these transparency aspects. And the very first one is the right to information. The right to information forms an obligation of the data controller to be satisfied before the processing of personal data and throughout the personal data processing. So GDPR is fixing modalities for informing the persons. It is fixing content of the information and specific rules related to the profiling and automated decision making. And we'll come back on these aspects now. Regarding modalities, the GDPR obliges data controller and processors to provide concise, intelligible information using clear and plain language adapted to the data subject, in particular when there are vulnerable people like children. The information must be easily accessible and free of charge. It can be provided by written or orally when it is authorized by applicable EU or national laws. And they must think about the capacity to reinform the data subject in case of changes in information provided or plans adequate safeguards to minimize the risks regarding such changes. These requirements open several opportunities in the fields, such as, for example, to develop texts and icons or other informational tools of high quality that will meet legal proofs requirements in order to ensure legal security. But it is also including challenges. The challenges are related to the difficulties in the field to summarize, to vulgarize, and to tailor the information to the audience. Multi-layered approaches could be used, but can be maybe less transparent for the data subject who is supposed to be active in the search for legal information and could be subject to click fatigue. And finally, diminish the transparency of the communication process. The multi-layered approaches can also be explored in order to lead to a dynamic e-consent, but this will only be authorized if it is planned to be valid in the EU and national laws applicable to the activity. Regarding the content, the GDPR is fixing a list of elements to inform, very important elements like the data controller and data protection officer identity and contact, the purpose of the processing and its legal basis, the recipients of the data or categories of them, the intention to transfer personal data outside the EU, and of much interest in our topic, the existence of automated decision-making, including profiling. This requirement open also opportunities in the field to work by design on what must necessarily be communicated in order to satisfy the fairness requirements toward data subjects. It necessitates sectoral practical guidelines that will help the controllers and professional users to meet their informational requirements. And there is an opportunity here also to involve samples of independent users and concerned persons in the design of communication tools and the information content. Challenges in our domain are to make explicit the use of AI-based decision-making system and profiling activities, particularly when a lot of information have to be legally provided to the individuals. This type of very important information could be hidden by others. Difficulties also to envisage fully the reuses of the data collected or generated for other purposes and the related legal bases and tools for the exercise of data subjects' rights. To identify the responsibilities prior to the deployment phases. This necessitates a clear data management plan, and in such an approach, the data protection impact assessment should help to organize accordingly. And where consent is used as a legal basis, there is a need to show that the data subjects understand exactly what they are consenting to in terms of envisaged use of AI system and consequences on their rights and freedoms. There are specific provisions regarding the AI-based decision-making system and profiling. There is a specific right not to be subject to decision-making solely based on automated personal data processing, including profiling, profiling, which produce legal effects or similarly affects data subjects. Some exceptions are planned also to this right when it is authorized by national or EU laws, when the processing is necessary to enter into or to implement a contract, or where the data subject explicitly consents to that use. Challenges are related to the ability to be aware of applicable legislations making such processing lawful and proportionate. And challenges are also related to the respect of complementary measures ensuring consent validity and lawful automated decision making. Because indeed, when we are in an exception, in the two last exceptions, we have to respect additional rights for the data subject. In particular, a right to explanation, and we will come back on it in a minute, and the right to obtain human intervention. Both additional rights in this context are raising specific challenges in artificial intelligence. First, there is a risk to overload in the right to explanation the data subjects with technical information and to practice finally unfair disclaimers. There are difficulties to elaborate informative elements in some context where we are dealing with black boxes. And it is difficult also to build in relevant explanation mechanisms into the artificial intelligence, but some research are ongoing on the topic. Regarding the right to obtain human intervention, there are challenges in artificial intelligence to involve, regarding the involvement of health professionals and the design of the intervention that is needed here. And there are also concerns that such a measure prohibits autonomous decisional AI system per se. Just to focus on some challenges related to black box AI decision-making systems compared to the requirement of explainability. In some cases, we have technical hurdles to explain the reasoning of the machine that will lead to a specific outcome. It is particularly true when we are using deep learning and artificial neural networks. Explainability also face legal hurdles that are not specific to black box systems, but are general to all AI systems, because explaining in detail the elements of the artificial intelligence can lead to IP rights infringements, to problems regarding digital security, to privacy risks, and finally to impossibility to meet the GDPR informational requirements. Regarding the right to explanation, the GDPR, I have to say, nicely requires that the data subjects receive at least meaningful information about the logic involved, as well as the significance and the envisaged consequences of such processing for the data subject. So it is a requirement a minima, but it is quite reasonable and quite possible to achieve, I would say. But good practices are needed here. I just wanted to signal that there is an entire new field of research that is explainable AI that is ongoing and develop a potential solution to overcome the challenge of black boxes and explainability in particular. The GDPR also plans some exceptions to the obligation to inform data subjects. This concerns situations where the data subjects already have the information and where the data have not been collected with the data subject when it proves impossible to inform the data subject, or if it would involve a disproportionate effort, or if it would make the achievement of the objectives of the processing impossible or seriously impair them. And in particular, in the processing for archiving purposes in the public interest, in scientific research, or statistical processing. This is subject to specific safeguards mentioned in Article 89. Each time a data controller or processor is based on an exception to a right, he has to justify actually his position and to plan adequate governance measures to diminish the risks regarding personal data protection. And there is a compliance duty as soon as the exception's rationale disappears. So an exception is not for life. So as soon as the situation arranged, they must comply. The third and last elements identified by the guidelines are traceability. And so here there is no explicit requirement under the GDPR to practice traceability. Traceability of what? Traceability of the computing processes and data, not of the individual. It is about the ability to trace and trace back the computing processes that led to an outcome. It is facilitating accountable management and explainability of AI-based operations. It is facilitating human oversights of artificial intelligence. It is facilitating the implementation of data subject rights and should be embedded within the AI technology by using blockchain, for example. So even if it is not required by the GDPR, we could see it as an enabler of other data subjects rights that are supporting transparency, in particular the right to access, to object or to restrict the processing, the right to obtain rectification or erasure of the data, the right to data portability that is applied on the personal data provided directly by the data subject, but also on the outputs data, so the inferred personal data, and also as an enabler to perform notification of personal data breach. The challenges in AI are related to the transparency paradox. Indeed, the implementation of these rights should not adversely affect the rights and freedoms of others, including trade secrets or intellectual property, and in particular, the copyright protecting the software. There are limitations specifically provided with regard to research and archiving processing, and AI stakeholders could also face technical hurdles to satisfy these rights. But for the notification of personal data breach, there are automated detection of breaches and notifications systems that are currently researched, currently developed. So this was just a focus. Of course, there are other GDPR principles that are challenged by artificial intelligence, and we could discuss about them later. About challenges regarding data minimization. This is due to the need of performing profiling of individuals. Challenges regarding data accuracy and the validity, finally, of the decision. Challenges regarding data integrity and confidentiality, in particular regarding the respect of, regarding the anonymization and the maintenance of anonymized data when using artificial intelligence, and challenges regarding purpose limitations and further uses of the data for other purposes, and regarding storage limitation, even if here there are specific provisions in the GDPR for scientific research and public interest purposes. So to conclude quickly, the transparency is key to the GDPR and contributes to preserve human agency, the freedom and autonomy of individuals in AI-based personal data processing, and finally diminishes risks of misuses or abuses. Generally, the GDPR is not incompatible with AI developments, but it includes a number of open prescriptions which ask for specific works, sectoral guidance, innovations which are challenging for AI stakeholders. So the GDPR alone is not sufficient, conversely to what has been said by the European Data Protection Board. It's not sufficient to reach the transparency level necessary to open public debates, to improve AI literacy, and finally to trigger full adhesion from concerned populations. And an important question that is not answered by the GDPR relates to the broader ethical acceptability of AI technologies. that need also to be particularly addressed. So thank you very much for your attention, and I hope that I not been too long.